A bit of health now. Governor of Taraba State, Agbu Kefas says the UNICEF-Gavi health support program has saved thousands of vulnerable children in Taraba through the use of vaccines. The governor spoke in Yola during a one-day retreat organized by UNICEF in partnership with the state government. Senior reporter Olabedinuse filed this report.
The healthcare sector in Taraba State has made significant improvement due to the impact of Gavi through UNICEF. The state is now rated #1 in the country at the last HPV campaign through increasing equitable and sustainable use of vaccines among vulnerable children. In this hall are critical stakeholders in the health sector in Taraba State. Speaking at the event, Taraba State Deputy Governor and Chairman, Task Force on Primary Healthcare, Aminu Alkali says government will do everything possible to sustain the gains the UNICEF and Gavi Health Support Project has brought to the state.
We have started well and we want to end well. So from now to the next coming 8 years, that is hope that everything about health in Taraba State is going to be okay, and people will appreciate our effort towards that direction.
The State Commissioner of Health and other speakers shared their views on how the program can be sustained.
We are in the last stage of PLC MOU investment. The state government needs to take full ownership of its implementation and its achievements. Government must reinforce its support, its effort to sustain and improve on these achievements.
We will look at what this MOU has brought on the table for our people, and also how do we sustain it since this MOU is only for 3 years.
A better approach towards solving this problem. How else can we do? Is it possible, for example, to say that, okay, the 300 staff that Gavi employed for us, is it possible that the various local governments can absorb them into their payroll? If we do that, then we don't have a problem. So for me, let us look at these issues. Let us not leave this issue to the governor alone.
So what we want is for the government to ensure that this project is sustained and the health workers that are currently on the payroll of Gavi UNICEF are absorbed into the state civil service.
This sustainability of the UNICEF-Gavi program is now of concern to some stakeholders in the health sector in Taraba State, as government is yet to show commitment through payment of our counterpart funding in the last 3 years.